Demonstrate normal anatomical position, various planes, relation, comparison, laterality and movement in our body. Learning objective: normal anatomical position, various planes, relation, comparison, laterality and movement in our body. Normal anatomical position. In the anatomical position, the human body is standing straight with looking forward, both the upper limbs by the side with palms facing forward. Feet approximated together with the toes pointing forwards. Term of relationship and comparison. Terms of movement. Flexion. Movement that decreases in angle between the anterior surface of the two bones or bending. Extension. Movement that increases the angle between the anterior surface of two bones or straightening. Right or left lateral flexion. Movement that causes bending towards lateral flexion, right or left side of the body, possible only with neck and trunk. Adduction, moving towards the median plane. Abduction, moving away from the median plane. Circumduction, a sequential movement involving flexion, abduction, extension and adduction so that distal part of the structure moves in a circle. Rotation, revolving of the part of the body around its own axis. Elevation, raises a part upwards or superiorly. Depression, lowers a part downwards or inferiorly. Medial rotation, movement that brings the anterior surface of a limb closer to the midline. Lateral rotation, movement that takes the anterior surface of the limb away from the midline. Protrusion, forward movement, as in scapula and mandible and tongue. Retrusion, backward movement, as in the scapula and retraction mandible. Pronation, occurs in forearm at proximal and distal radio-ulnar joint. Movement that causes palm to face posteriorly toward the ground. Supination, occurs exclusively in the forearm at proximal and distal radio-ulnar joint. That causes palm to face anteriorly toward the roof. Opposition, movement that allows the tip of the thumbs to touch the tips of other fingers across the palm. Reposition, movement that brings the tip of the thumb from the opposition to normal position. Inversion, occurs exclusively in foot. Movement that causes medial border of the sole to face inward and upward. Eversion, occurs exclusively in the foot, causes lateral border of the sole to face outward and upward. Different planes of the body. Mid-sagittal plane or median plane passes through the center of the body. The body is divided into two equal halves, right and left. Sagittal plane, any longitudinal plane which is parallel to the mid-sagittal plane. Coronal plane. This plane is perpendicular to the sagittal plane. The body is divided into two halves, anterior and posterior. Transverse plane, perpendicular plane to the sagittal and coronal planes. The body or part of the body is divided into two parts, upper and lower. Different sections in the body. Transverse or cross section. In this section, the slices of the body are cut in a plane perpendicular to the longitudinal axis of the body or parts of the body as in a CT scan. Longitudinal section. This section passes parallel to the longitudinal axis of the body or parts of the body. Oblique section. refers to section of the body cut in planes or direction, excluding the transverse and longitudinal sections. Laterality. The term laterality is related to which side the structure is present, like unilateral, structures present on one side of the body only. Example, spleen, liver. Bilateral, structures present on both sides of the body. Example, kidneys, lungs. Ipsilateral, structures present on same side of the body. Example, right thumb and right toe. Contralateral, structures present on different sides of the body. Example, right thumb and left toe, or right toe or left thumb.